Understanding brain cancer, an introduction. Brain cancer is a complex group of diseases characterized by the uncontrolled growth of abnormal cells in the brain. These abnormal cells form a mass called a tumor, which can be either malignant or cancerous or benign, meaning non-cancerous. Malignant brain tumors are further classified as primary or secondary. Primary brain tumors originate in the brain itself, while secondary brain tumors, also known as metastatic brain tumors, spread from cancer that started elsewhere in the body. The brain is a delicate and vital organ responsible for controlling our thoughts, movements, senses, and bodily functions. The skull, a hard, bony structure, encases and protects the brain. This makes the diagnosis and treatment of brain tumors particularly challenging. Unlike other cancers, brain tumors rarely spread to other parts of the body. However, they can grow large enough to press on and damage surrounding brain tissue, leading to a range of neurological problems. The impact of brain cancer extends far beyond the physical symptoms. A diagnosis of brain cancer can be emotionally devastating for patients and their families. The uncertainty surrounding the disease, coupled with the potential for cognitive and physical impairments, can significantly impact quality of life. Understanding the different types of brain cancer, their causes, and available treatment options is crucial for healthcare professionals. This knowledge empowers us to provide the best possible care and support to our patients facing this challenging disease. Decoding the types of brain cancer. Brain tumors are broadly classified by the type of cell they originate from and their location within the brain. There are over 120 types of brain and central nervous system tumors. Some of the most common types of primary brain tumors include gliomas. These tumors arise from glial cells, which are supportive cells in the brain that surround and nourish neurons. Gliomas are the most common type of primary brain tumor, accounting for about 30% of all brain tumors. Examples include astrocytomas, glioblastomas, and oligodendrogliomas. Meningiomas. These tumors develop from the meninges, the protective layers of tissue that surround the brain and spinal cord. Meningiomas are typically slow-growing and often benign. They are more common in women and are usually diagnosed in older adults. Pituitary adenomas. These tumors originate in the pituitary gland, a small gland at the base of the brain that produces hormones. Pituitary adenomas can cause a variety of hormonal imbalances, depending on the hormones they produce. They are usually benign and slow-growing. Each type of brain tumor has unique characteristics, growth patterns, and treatment approaches. Understanding these distinctions is essential for accurate diagnosis and effective treatment planning. It also allows us to provide patients with tailored information and support throughout their cancer journey. Shedding light on the unknown. While the exact causes of most brain tumors remain unknown, several risk factors have been identified that may increase an individual's likelihood of developing the disease. It is important to remember that having one or more risk factors does not guarantee a brain tumor diagnosis, and many individuals develop brain tumors without any identifiable risk factors. Age. The risk of developing a brain tumor increases with age. Radiation exposure. Exposure to ionizing radiation, such as that used in medical imaging and radiation therapy, is a known risk factor for brain tumors, particularly in children. Family history. Having a close relative with a history of brain tumors may slightly increase your risk. Certain genetic syndromes. Some rare genetic syndromes, such as neurofibromatosis, tuberous sclerosis, and Li-Fraumeni syndrome, are associated with an increased risk of developing brain tumors. While we cannot control factors like age, family history, or genetic syndromes, we can minimize exposure to controllable risk factors such as radiation. It is important to use radiation-based medical imaging, such as CT scans, judiciously, especially in children. Recognizing the symptoms, a crucial step. Brain tumors can manifest with a wide range of symptoms, depending on their size, location, and growth rate. Recognizing these symptoms early is crucial for prompt diagnosis and treatment. Common symptoms of brain tumors include headaches, new-onset headaches, especially those that are more severe in the morning or worsen with coughing or exercise, can be a warning sign. Seizures, particularly in adults without a history of epilepsy, can be a symptom of a brain tumor. Weakness or numbness. Gradual weakness or numbness in the arms or legs, especially on one side of the body, can indicate a brain tumor affecting the motor or sensory areas of the brain. Vision problems, double vision, blurred vision, loss of peripheral vision, or other visual disturbances can occur with tumors affecting the optic nerve or visual pathways in the brain. Cognitive and behavioral changes. Brain tumors can affect cognitive function, causing problems with memory, concentration, language, and personality. It is important to note that these symptoms are not specific to brain tumors and can be caused by other medical conditions. However, if you or someone you know experiences any of these symptoms, it is essential to seek medical attention promptly for proper evaluation and diagnosis.